Hello, boys and girls. We are here in beautiful Gatlinburg, Tennessee, right on the gateway to the Smoky Mountains National Park. In the distance there, you see beautiful Mount LeConte, the highest point in the park.
I think there's still a little snow on it.
And you'll see a little bit of snow on it. I don't know if you can see that. You probably can. All right. Well, but that is not what we're going to be talking about today. Today, old Dr. Bones decided he was going to do an impressive hike, and so we did a hike a little bit more than 8 miles. And there you see my old Caterpillar boots and some nice wool socks, and you see the beautiful Nurse Amy right there.
They're thick, and I have these on too.
Right, but unfortunately, silly me, I did not put on my liners, so therefore I have
Can you see it?
managed to get
Let's roll this up here.
a pretty impressive
I'm not
blister,
going to touch it yet.
which burst on our hike after.
Okay. We took off Dr. Bones' sock very gently and his shoe very gently so we wouldn't incur more damage. I was hoping that the cover for the blister, the skin that was bubbled on top, would still be intact because that's going to cause less pain for him while it's healing. However, it is popped open, so it's going to be much more difficult to heal. What we want to do is open up a package of gloves here first. And never touch a patient without gloves. Now, obviously, if we were still out in the woods, you want to get as clean as possible. So, gloves will keep my bacteria on my hands away from Dr. Bones. And a lot of people who are hiking have Ziploc bags. So, if you can get your drinking water into a Ziploc bag, you can actually make an antiseptic. Now, we have taught you before, and we've talked about this several times, that drinking water is just as good as an antiseptic wash, but I feel better doing this because this is how I was medically trained. Now, if we were outside, it wouldn't matter where he is, but I need a bowl here, so I'm going to ask you to put your foot in this bowl.
What?
Put your foot in that bowl.
What?
There you go.
Oh, brother.
Hold it steady. All right, we're going to cut a small hole in here while it's not pointed that way, and we're going to, as hard as possible, wash this blister with a jet. I'm squeezing this bag of water. Okay, we have just washed that up. All right, now you can take your foot off of that and set it on the clean towel that I have.
All right.
There we go. Very good. Now that blister is clean. So I'm actually going to dry it with a washcloth that I have. However, you can use gauze to dry, and I'm only drying it so it has an area that's going to stick. Now, what you're going to do next is take a piece of moleskin, and we happen to pack Dr. Scholl's moleskin in our handy dandy hiking packs or personal packs. And you're going to cut a square. Now, you want this square much bigger than the hole because you have to cut a hole in the middle of the square matching the blister size. So if you look at this, this is much bigger than this blister is. And I'm just going to point out, because I know it's a little difficult to see. Here's the blister, this circle right here. And there's a flap of skin here. We could cut that skin off if it's just hanging by a little piece, which it is. So I'm just going to go ahead and cut this off because this is going to become dead skin. So we're just trimming that skin off. Hopefully I'm not hurting you.
Nope, not at all.
There we go. That's gone now. Now let's go ahead, and it's easy to cut a circle in this if you fold it. So you fold it like this. And we do have big scissors and we have little scissors. I'll use the big scissors since I use the little scissors to cut your skin off. And we're just going to cut a half circle since this is folded. And it's not easy with these big gloves on my hands. Alright, so I'm going to get a circle out here. And then I'm going to make sure that is bigger than the blister. And I'm going to try and see if you can tilt your foot just a little bit more so that everybody can see that this is bigger than the blister. So we're going to go ahead and unpeel it because it has a sticky back. Again, this is not easy with gloves. Okay, managed to do that. So we're going to place this around the blister. Perfect. And then just gently push around it. Okay, that is the first part. Now what I want to do, since this is raw skin here and we want it to heal, is we want to put a little Neosporin on it. So get just a little bit, and we want to put that in the middle on the blister and just kind of smush it around a little bit.
It looks good.
Alright, so I'm going to wipe off some of this Neosporin from here because we want another piece to stick on there. Okay, now what we're going to do is put just a square piece over that to give extra padding to protect the open area and to help keep the Neosporin in place, because if you have to continue your hike, actually we're okay not using gloves on this one piece because we're not directly touching the wound. Okay, don't touch the middle of this when you're peeling it open if you're not using gloves, because the center of this is going to be touching the open wound. So, make sure that Neosporin is off. And we're going to put this directly over here. Now, if you're afraid this is going to slide around a little bit, there's one additional thing you can do. Any type of gauze that you have, sterile or unsterile at this point, will be fine. Remember, your wound is covered. So if you don't have gloves or they've gotten sticky, it's okay. You're going to place that there, and you're going to use a piece of tape to hold that on for extra padding and to help hold that moleskin in place. Okay, this is good tape, I have to tell you. I haven't had to use it too many times, but it is good tape. Alright, so this is going to go in the middle there. This is going to go here. And just like that, we have lots of padding. Now you could put additional tape to hold these down, but since he's not going to be putting his sock back on to continue hiking, it's actually okay for him to go like this for the evening. And then in the morning you want to change the moleskin, put some more Neosporin or triple antibiotic ointment or even raw honey, and then you may want to put an additional piece of tape here and here. But you really have 3 layers. You have your open hole, you have the additional moleskin on top, and now you have one folded 4x4 gauze with tape on. So that will help protect it. Make sure you change that at least once a day.
Yes, ma'am.
Clean it up every single time with a little drinking water or some Betadine water. And this is Nurse Amy and Dr. Bones in the beautiful Gatlinburg after taking a long hike and getting a blister.